So in this video, we'll be focusing on the extrinsic muscles around the shoulder region. Because we talked about the muscles around the shoulder region, which is the helps to stabilize the scapula. They helps to move the shoulder joint in all range of motion, and they helps in doing all movements we all know, which is abduction, flexion, and everything. So they also assist. Some of them also assist in breathing, also, which we'll also be talking about, especially in venous return. So when you have venous return helps to bring the venous blood, which is the deoxygenated blood, back to the heart. Very, very easy. We're talking about the extrinsic muscles. So the extrinsic muscles, they are more superficial. You can easily see them. When you strip the skin, you see them. But the deep muscles, you cannot see them because they are the workforce muscle, which they help in rotation, doing everything that we have talked about in the last video. In the extrinsic muscles, we'll be dividing them into superficial and deep. We're dividing them into superficial and deep. The superficial muscles are two in number. Which is the trapezius and the latissimus dorsi. Don't forget. Under the extrinsic muscle, which is the muscles you can see outside. Now, why the deep muscles are the intrinsic muscles, which we discussed, see down there. Now, the extrinsic muscle, you divide them into superficial and deep. So when you strip the back now, you'll be seeing two muscles. First of all, one upper, which is the upper part of the back, while one in the lower aspect of the back. Now, the one in the upper aspect of the back. Now, follow the diagram you're seeing. The one in the upper aspect of the back is the word trapezius, while one in the lower aspect of the back is the word latissimus dorsi. Keep it in your head. Latissimus dorsi are down, trapezius up. Don't forget, they are the superficial muscles. They are the superficial muscles. In that same extrinsic muscles, now you have a deep part, but more superficial to the intrinsic muscles. So don't forget, it's more superficial to the intrinsic muscles. And now you call them what? The Levator scapulae and the rhomboid major and minor. Don't forget. So we have two muscles in the superficial and three muscles in the deep part of the extrinsic muscles. So now we'll be picking the first one, which is the upper part, which is superficial, the trapezius. Now, one thing you have to know that the trapezius is a very, very large muscle. It's a very, very large muscle. It's located in the upper part of the back, so which I've discussed with you before. In the upper part of the back. So when you are pinching the upper part of your head close to your neck now, that muscles you are pinching. So sometimes when people are stressed, they'll say, "Come and massage my back." So people will focus on massaging the upper part of the back. So what are they massaging? They are massaging the trapezius muscle. So the trapezius muscle is a broad, flat, and triangular muscle. Are you getting me? So it is a broad, flat, and triangular muscle. So it assumes this trapezoid shape. Why they call it the trapezoid muscle? It was achieve, or it's like the trapezoid shape. And just like the pectoralis major, it is the most superficial in the shoulder region. The most superficial in the upper part majorly of the shoulder region. So it covers all the whole muscle. So when you strip the skin and the superficial fascia and the deep fascia of the back, you first see the trapezoid muscle first in dissection. So for those of you that are doing dissection, so it's very easier for you to see the muscle. So you are seeing it on the screen now. So now where is it originating now? Where is it originating? Now it's originating from the skull. Which part of the skull? The external occipital protuberance. So if you go to my skull video, which is the normal occipitalis, which is at the back, so we have the normal frontalis, normal basalis, normal verticalis, normal occipitalis. So at the back, where if you look at the back, the most pointing part is the external occipital protuberance. So the first part is from the posterior side of the skull, called the external occipital protuberance, which is that part in your back of your head that is pointed. So where for those of you watching, unless you are taking head and neck classes, to be much more important for you to know. So it's coming from the external occipital protuberance, going from the external occipital protuberance down to the neck. It's coming from the noqua line, which you call the noqua ligament. So it's coming from the noqua line or noqua ligament. So first of all, external occipital protuberance to the noqua ligament, or are you getting me? The noqua ligament, which is running from the external occipital protuberance. And also it is coming from the spinous process of C7 to T12. Don't forget it. External occipital protuberance, noqua ligament, which is running from the external occipital protuberance to the cervical vertebrate. So the noqua ligament, you are seeing it on your screen now, the noqua ligament, and it's now coming from the spinous process of C7 to T12. So the C7 to C12 have different spinous what process, and it's coming from the last part of the cervical bone, down to the what, the T12, which is the last part of the thoracic bone. You are seeing it on your screen now, so it's very easy to isolate the muscles by yourself. So since we know its origination now, what is its insertion? So where is it inserting? So just like the deltoid is originating from three parts, it is inserting also in three places. It's inserting where? In three places. Now you start from the first one. It's inserting in the front. It's inserting in the front. Because the deltoid has an anterior fiber that is originating from the lateral one-third deltoid, lateral one-third part of the what, clavicle. So now the same thing, the trapezius is inserting in the anterior fiber. So the anterior fiber of the trapezius is inserting in the lateral one-third, but in the posterior division. Why the deltoid is originating from the anterior division of the lateral one-third, why trapezius is inserting in the posterior division of the lateral one-third part. So hope you are getting it. So in the lateral one-third, you have the anterior where the deltoid is coming, originating or coming from, why the trapezius is inserting on the anterior fiber in the posterior one-third part of the clavicle. So now also it has a posterior fiber. So the posterior fiber is inserting in the word scapula. The posterior fibers is inserting in the word scapula. Also, I told you also have a medial fiber, just like the deltoid. So the deltoid is having three origination and one insertion. But the trapezius is a very big muscle, so it's inserting in three places. So we say the clavicle, posterior one-third part of the clavicle. Now it's inserting on the scapula, on the spine of the scapula, on the spinous process, and also is inserting on the what, acromion. So very easy. So three parts, three insertion. Why the same three insertion is where the deltoid is originating, three two: clavicle, acromion, and scapula. So now what is the nerve supply? What is the nerve supply? Now it is supplied by the what, spinal accessory nerve. So it's also supplied by the spinal accessory nerve. So remember that under the cranial nerve you have the 12th cranial nerve. So the 11th cranial nerve is the accessory nerve. So accessory nerve can be cranial accessory and you can have the spinal accessory. So do you get it now? So the cranial accessory in your head and neck, we'll discuss that. Why the spinal accessory is also inserting the, it's also innervating the word trapezius, and also it's also taking innervation from C3 C4 part of the cervical plexus. So the spinal accessory nerve and C3 C4 as nerve of the word cervical plexus. So what is the movement? So if you remember, red, RRED, that is very simple. RRED. So what is RR? So red like red color. So what's RRED? The first one is R, rotation of the scapula. Always remember, it rotates the scapula. How does it rotate the scapula? It rotates the scapula in all directions. Are you getting now? It rotates the scapula in all directions. So another R is what? Retraction. So what fiber is it using to retract? Always remember, it is using the middle fiber to what? Retract the scapula. So don't forget, retraction of the scapula using the middle fiber. So when you are retracting the scapula, as if, okay, somebody flog you cane at your back. If somebody is flogging you cane at your back, what do? Push your chest forward. That your chest forward, you are retracting your scapula like that. You are seeing it on your screen. So RR, rotation of the scapula, retraction of the scapula. So what is he doing? E is what? Elevation. So the anterior fiber is elevating the scapula. So how do you elevate? Now show as if you are proud. You are proud, like putting your allow your shoulder to touch your ear. So if you want to allow your shoulder to touch your ear, that is what we call elevation. So you are elevating your scapula by putting your head up, just like the way you are seeing on your screen now. Elevation. So you elevate like that. The next one is depression. So how do you depress? So you are using the lower fiber to depress your scapula. Okay, so upper fiber, lower fiber, middle fiber, and rotation. So what is that rotation of the scapula? When you rotate the scapula, what happens? You do what? Hyperabduction. So the serratus anterior and the trapezius does hyperabduction. So what is hyperabduction? 180-degree abduction, as if you are what? Telling God, you are thanking God, putting your hand, waving your hand up to say thank you to God. So when you are doing like that, then what are you doing? You are doing what? Hyper abduction. Very easy. So remember red, Are you getting me? Remember it. Remember the insertion. Remember the origination. So the next one is Latissimo. We call it Latissimus dorsi. So I call it Latissimo for short. Latissimo for short. So where is Latissimus dorsi? You can see it in the lower aspect of the back. So where is it coming from? Very, very easy. It also have different origination. So you have to open your ear very, very well. So it's coming from the spinous process. Spinous process of T7 to L5. T7 to L5. Why the origination of the trapezius is from about C7 to T12, the spinous process of C7 to C12. Why this one is coming from what? The spinous process of T7 to L5. Are you getting now? So there's always a spinous process on the vertebrae. So it's originating from T7 to L5. Also, it's coming from the thoracolumbar fascia. So what is thoracolumbar fascia? This is the fascia covering the back. The fascia covering all muscles of the back, the erector spinous, serratus posterior, all of them. Are you getting me now? So it's covering the back. The fascia covering the. So it's also originated from the thoracolumbar fascia covering the back. Now it's also coming from the iliac crest. So what is the iliac crest? The iliac crest is the highest point of the what? Hip bone. The highest point of the hip bone, especially the ilium. The highest point of the hip bone is usually at L5. Approaching L4, L5, so usually at L5. So that highest point is called the iliac crest. So it's also coming from the iliac crest. And also lastly, the lower rib. So it's coming from the spinous process of T7 to L5, coming from the thoracolumbar fascia, coming from the iliac crest, and also the lower ribs. So where is inserting? Just remember the lady in between the two major. The lady in between the two major. So who is the lady in the middle? So it's coming from the floor of the what? Bicipital groove. The floor of the bicipital groove. I told you that the bicipital groove can also be called intertubercular sulcus or intertubercular groove. Intertubercle is in between the two tubercle. So when the greater tubercle, the line of the greater tubercle is coming down and the line of the lesser tubercle is coming down, in between is the intertubercular sulcus or the bicipital groove. Get it back. So since it's inserting there, what is the nerve? The nerve is the thoracodorsal nerve. The nerve is the thoracodorsal nerve. So the thoracodorsal nerve is coming from the what? The posterior cord, C6 to C8. C6 to C8. Now, because of it's coming from the spinous process now, it's originating from the spinous process. So what will be its function? Its function will be the same thing: adduction, medial rotation, adduction, medial rotation, and you can also do extension. So why is it extending? It's the muscles inside the back, so it extends. Unlike the pectoralis major that also does adduction and medial rotation, but this one it's flexed because of its clavicular origin. While the subscapularis, what does subscapularis do? Adduction and medial rotation. While the teres major does abduction and medial rotation. So you get it now. So four of them does the same thing. So we call it the handcuff muscles. Call it the handcuff muscles because when you handcuff somebody at the back, so the person that helps you, that at that point when you're handcuffing them, is the what? Latissimus dorsi. So the next one I'll be going to is the deep part of the what? Extrinsic fibers. The deep part of the extrinsic fiber. Because in the last video you watch the superficial part of the extrinsic, which is the Latissimus dorsi and the trapezius. So I took my time to explain the muscles very well. But in this one now we are talking about the deep part of that same extrinsic. Now what are the deep parts? We have the Levator scapulae, we have the rhomboid major and the what? Minor. So I'm taking my time to explain each one very well so you will know the movement personally. So what are we going to talk about? The Levator scapulae muscle. The Levator scapulae muscle is a small strip-like muscle. It is a what? A small strip-like muscle which begins from the neck and inserting the scapula. It's a small strip-like muscle which begins from the what? Neck and descend to insert in the what? Scapula. So what is the origination? So you are seeing it on your screen. What is the origination of the Levator scapulae? Because mind you too, the Levator scapulae forms the floor of the posterior triangle. So it's forming the floor of the posterior triangle of the neck. So it's forming the floor of the posterior triangle of the neck. For those that read the triangles of the neck, so I'll make a video on that also for those studying head and neck. It is originating from the transverse process of C1 to C4. So the vertebrate of C1 to C4, that is where the what? Levator scapulae is coming from. Just like the name Levator, taking the neck upwards. So it's very easy. Transverse process of C1 to C4, and it's inserting in the medial border of the what scapula. But now when you say the medial border of scapula, you're talking about the posterior aspect of the medial border of scapula, because the serratus anterior is inserting on the anterior aspect or anterior surface of the medial border, while this deep extrinsic muscle is inserting on the posterior medial border of the what scapula. So it is originating from transverse process of C1 to C4 and inserting on the what the posterior surface of the medial border of the scapula. Nerve, those are scapular nerves. So most of all these deep extrinsic muscles are what innervated by what those are scapular nerve. Very, very important. So that is where they are innervating. So what is their work? Elevation of the scapula, just like the name. um just like the name, levator scapulae. Levator scapulae, I elevate my scapula. I elevate my scapula. So that is the same. So when you are elevating your scapula, you are using two muscles. You are using the trapezius, which is how do you elevate. You are using the anterior fiber of the trapezius, and you are also using the what, the levator scapula. So also know that the levator scapulae form the floor of the posterior triangle of the neck. The next one is the rhomboid muscles. Now, so the rhomboid muscle, we have the major part and we have the minor part. While you have the major and we have the minor based on how big it is. The major is more bigger while the minor is more smaller. Just like we have the teres major and teres minor. Teres major is bigger while teres minor is smaller. So teres minor only does what? Lateral rotation, while the teres major does about 3 functions. P major, P minor. P major very, very big, or P minor very small. So it's just how it is. But in this one, P minor is more superior than the P major. So you are seeing it on the screen. P minor is more superior than the P major. So where is the P major coming from? P major is coming from the spinous process of T2 to T5. So when you are coming from T2 to T5, you remember, because the levator scapula is coming from C1 to C5. Because the levator scapula is coming from C1 to C4, but the transverse process of C1 to C4. Why the rhomboid major is coming from the spinous process of T2 to T4. Are you getting me? So just don't get it confused. Don't get it confused. But trapezius is what originating from what? External occipital protuberance, nuchal ligament, and what? Spinous process of C7 to T12. Why why latissimus dorsi is coming from what? Why Latissimus is coming from what? T7 oh, to about L5. Don't forget. Why this one is coming from what? T2 to T5. Very simple. And where is it inserting? Just like the levator scapulae is inserting on the what? Posterior surface of the medial border. So what is the action here? So what's the action? The action, like I said, they always retract the scapula. They retract the scapula. The rhomboid major what? Retract the scapula. So who retracts the scapula in the trapezius? The trapezius is retracted by what? Inferior border. So the inferior fiber that is inserting for the trapezius is retracting, while this one, the normal rhomboid muscles, they also retract. While the levator scapulae elevates just like the trapezius. So the trapezius also have the functions of the deep extrinsic muscles, because it elevates with the levator scapulae and it retracts with the rhomboid muscles. So very, very easy. So in this rhomboid major, it what? Retract and also rotate the scapula. It retract and also rotates the what? Scapula. So what is the nerve? Also dorsal scapular nerve C5. Now for the rhomboid minor, it was superior. Like I said, the rhomboid minor is very superior. So what is the origin of the rhomboid minor? Now the rhomboid minor is originating from what? The spinous process of what? C7 to T1. The spinous process of C7 to what? T1. While its counterpart, which is rhomboid major, is T2 to T5. Very simple. C7 T1. So where it is ending at T1, the rhomboid major is beginning at T2 to T5. Very, very easy. Inserting on the same part. So it's inserting on the same part, inserting on the posterior surface of the medial border. Are you getting now? Now this is at the same level. Also, it's inserting at the same level at the spine of the scapula. So where the spine of the scapula is, that is where it is what? Inserting. Why the rhomboid major is inserting below the rhomboid minor, which is towards the inferior angle of the scapula. So I hope it all made sense to you and you have understood everything I've talked about in all these muscles. So where we talked about the superficial part, we talked about the deep part. In the superficial part we talked about trapezius and we talked about latissimus dorsi. But in this one we talked about the levator scapulae and we are talking about the rhomboid muscle, how they retract and how they do everything they do. So keep watching my video, because I'm making so many awesome videos for preclinical students and clinical students for you to understand what the basic part of what anatomy biochemistry, physiology, and everything. So I want you to be very, very strong in it. Your hand to be strong. You should be very, very intelligent so that you should approach patients very well. Because when you approach a patient with any of muscle weakness, you can what isolate the muscles that are damaged. And when you isolate muscles that are damaged, look for basic clinical principles or clinical what procedures in order to bring them back to what the activity of daily what living. So very, very easy. We'll be moving to my next video, which is muscles of the what arm, or the muscles around the arm. So this one, now we see that all these muscles we have done now of the pectoral and shoulder joint, they are working on the what shoulder. Are you getting now? So they are working on the shoulder joint or glenohumeral joint. So the muscle we did on the pectoral and the shoulder region, they are working on the shoulder joint. So now this one we're doing the muscles around the arm. So it's very, very easy to stay to the next video. Continue watching, continue also learning the origin and insertion of head. So I'll see you in my next video. Bye bye.